My name is Michelle Gomez Mendez, and I am at East Carolina University.
I am Matthew Cassino. I'm a rheumatologist and an employee of Genentech.
I am Paul Brakeman from the University of California, San Francisco, and we are here to summarize the paper Peripheral Blood B-Cell Depletion after Rituximab and Complete Response in Lupus Nephritis, published by the Clinical Journal of the American Society for Nephrology.
In lupus nephritis, B cells damage the kidney by creating immune globulins that form immune complexes that deposit in the glomeruli. B cells also damage the kidney by aggregating in large numbers in the tubular interstitium, which causes interstitial inflammation and scarring. For these reasons, therapies that target B cells have the potential to improve the disease course. Rituximab is an antibody that depletes B cells, and it was studied as a potential therapy for lupus nephritis in the pivotal Lupus Nephritis Assessment with Rituximab, or LUNAR study. LUNAR failed to demonstrate increased complete response rates with rituximab over placebo when added to a background of mycophenolate mofetil and steroids, and rituximab is not approved for the treatment of lupus nephritis.
Mouse and clinical models of lupus nephritis have revealed that administration of rituximab does not consistently result in complete depletion of B cells in the peripheral blood. Rituximab may also result in incomplete depletion of B cells in the tubulointerstitium of the kidney, which could limit the efficacy of rituximab. We analyzed data from participants of the LUNAR trial who received rituximab in order to evaluate for differences in the rates of achievement of a stringent measure of depletion of B cells in the peripheral blood and whether these differences were associated with response. We found that complete depletion of peripheral B cells, defined as 0 CD19 positive cells per microliter, was associated with a higher likelihood of complete response in the kidney 18 months after the start of treatment.
We also found that shorter time to achievement of complete B-cell depletion, as well as longer duration of complete B-cell depletion, were associated with complete response in the kidney 18 months after start of treatment. In summary, our study was in agreement with prior observations that there is variability in the degree of B-cell depletion in the peripheral blood of participants who receive rituximab for lupus nephritis. Our study also supports the hypothesis that greater degree and duration of B-cell depletion, as well as shorter time to B-cell depletion, are all associated with improved kidney outcomes 18 months after start of treatment. Thank you for listening.
This podcast is copyrighted by the American Society of Nephrology, all rights reserved. All content in this podcast is for informational purposes only and is not intended to be medical advice. This podcast should not be used in a medical emergency or for the diagnosis or treatment of any medical condition. Please consult your doctor or other qualified healthcare provider if you have any questions about any medical condition or before taking any drug, changing your diet, or commencing or discontinuing any course of treatment. Thank you for listening to this podcast of the American Society of Nephrology.